we are anticipating that later on in the week, on Thursday, we'll be getting an update again from the science table. So we're looking forward to that as well, to see how well are we doing with our maintaining distancing and stay at home whenever essential. And I'll comment about that more in a moment. But first, I'm going to hand things over to Dr. Yaffe, who's going to give us an update on the data and different numbers for today and over the weekend. So over to you, Dr. Yaffe.
Thank you very much. Good afternoon, everyone. Since our last update on Thursday, Ontario is reporting an additional 4,523 cases of COVID-19. That's 1,150 on Friday, 1,228 on Saturday, 1,087 on Sunday, and 1,058 cases today. The new cases in today's update include 325 in Toronto, 215 in Peel region, and 87 in York region. Our 7-day average for daily cases is currently 1,045, which is slightly lower than the same period last week when the average was 1,051 cases. We're also reporting an additional 99 deaths since our last update on Thursday. Our 7-day average is 24 deaths per day, which is the same as it was basically last week in the same period. Currently, we have 646 people with COVID-19 in hospital and 280 in the ICU. At this point last week, there were 739 COVID-19 and 293 were in the ICU. We offer our condolences to the friends and family of those who have lost loved ones, and we offer our thoughts to those who are in hospital and recovering from this disease. With respect to testing, today we're reporting 31,163 tests completed with a 3.3% positivity rate. These low volumes of testing are often observed following a weekend. The average percent positivity over the last 7 days is 2.7%, which is slightly higher than the 2.6% for the same time period last week. Today, we're reporting a total of 400 confirmed variants of concern in Ontario. 390 are the B117 variant, which was first identified in the UK. 9 are the B1351 variant, first identified in South Africa, and 1 of the P1 variant, first identified in Brazil. Based on this analysis, 80% of our variants of concern are either outbreak-associated or close contacts of a confirmed case. Just over 12% have no known epidemiological link, and 7% are travel-related. These statistics have remained relatively unchanged since we began reporting on variants. In addition to officially confirmed cases, we are now also publicly reporting on those COVID-19 samples that screen positive for the N501Y mutation, and that is the first step in a two-step confirmation process. Eligible COVID-19 positive samples are screened for the N501Y mutation, and if positive for that mutation, then undergo whole genome sequencing to confirm the presence of a designated variant of concern. To date, 16,495 samples have been screened for the 501 mutation, with a 7-day average positivity rate of 10%. When we look at the most recent weekly data from February 15th to the 21st, 5,370 samples were screened for the mutation with a 14.3% positivity rate. I'll turn it over now to Dr. Williams.
So thank you, Dr. Yaffe. So we see our data. We've been hovering around about 1,000 cases a day, new ones reported. While that is, we'd like to see it going down. At the same time, as we were aware from our modeling from not last week, the week before, we were concerned about this transition period here at the end of February going to early March, and where we see more and more variants being identified, as Dr. Ayafi alluded to. Those numbers at the moment are still staying in the lower end, but we have to be very cautious, and we're being very concerned about where that might go. So this is this precarious time that Dr. Brown alluded to, and we hope to get an update from him this Thursday. As you're aware that as of midnight last night, all but 3 of our public health units have returned into the so-called colored framework that was put in the fall for a graduated closing down around the province with the different color codes closing different things at different levels. To be clear, that's not an opening up. It is a graduated relaxing of some of those lockdown or closure measures in each level. At the same time, it doesn't mean that one can neglect the personal issues and responsibilities at this time. In fact, there's more need for it than ever. So, for example, York Region had re-entered the framework in the red zone, while some of the others, such as Peel, Toronto, North Bay, and had remained in the so-called stay-at-home order, and Niagara in the gray zone as well. So we had looked at this and the general numbers, and Dr. Kurji was consulted and felt confident that they could deal with those some increased services that are available to the residents of his area, York Region, while a lot of others still remain under constraint in that. So we have those things in place. We'll be reviewing the data and then taking recommendations again to the minister in the next day or so, and to see if there's any changes in the framework. But what we've intended to do is to say we will be fairly quick at moving things up if things start to happen the wrong direction. We're going to be very cautious about opening and need to have a period, a trend of improvement before we go down to a lower level, to be on the cautious side, especially as we're trying to see this transition from the regular COVID, other COVID cases coming down, and the so-called variants of concerns taking up more and more of a percentage of the cases. As the modelers have put forward in Dr. Brown, it's the time we have to really observe and really watch for. That brings me back to the point that while you may be in different levels of the framework, and there may be some services available now, it doesn't mean that means your personal vigilance is relaxed. It is not. And you need to keep doing those on a very regular basis. The masking, the distancing, staying at home unless you really need to go out. Access the services when you really need to, not just on a casual basis. Maintain your distancing when you do use those. Maintain your masking, because the better you do that in your local areas and you stay local, if I may use that term, the more longer and maybe perhaps in the future more opening there will be if you maintain those steps there. On your personal level, it is person-to-person spread that's the issue. And I know that you have been asking for those things. We're aware of that and trying to do that. The concern is that by opening this up, will people say, then we can be casual in our personal protection? Nothing could be further from the truth. And with our variants of concern, their ease of transmittability between person to person, you're going to have to be more vigilant personally than maybe you have been up to now. But I think a lot of people have been pretty careful overall. And I think we're hoping to hear some evidence from Dr. Brown how well we are doing on that. And as Ontarians, we have done that before. I think we can do it again and keep pushing forward on that. So stay at home, limit the non-essential trips, masking anytime out in public when you can't guarantee, because just because someone says they haven't got a problem, you can't be sure they don't have a problem. And so you're going to have to take that. Unless it's part of your household, and that's a different thing altogether. So those are our key messages as we go to the week ahead, as we go into this transition from the end of February into March. This is a pivotal time, as we heard from the modelers, and we want to see how we're making advance. At the same time, you've heard the news, more vaccine coming, more vaccine to come. And so that, under General Hillier and the task force, is making strides and progress to complete the phase 1 and move with other areas in that. And so we're glad that delay's over and that pause, and we want to pick up pace on that and pick up on that with well over 500,000 being done so far. I'm looking forward when we'll have that 1 million number, and I'm sure the general is looking for that as well. So with that, we'll open up to questions from the media. Thank you.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
Hi. As a reminder, should you like to ask a question, please press star followed by 1. Your first question comes from John McGrath from TVO. John, please go ahead.
You mentioned the vaccines, Dr. Williams, and there's been a lot of news out lately of increasingly strong science showing the very strong effects of even just getting the first of the Pfizer or Moderna shots, and even in cases where the second shot was very, very delayed, like substantially beyond the time frames we're talking about right now. And I'm just wondering, there are certainly voices who are calling for a policy of, get everybody their first shot before we go back and do second shots because this data looks so promising. Is that something that you are advocating with either your provincial or federal counterparts, or is that the kind of thing that Ontario might do even without clear Health Canada guidance?
So I'll be handing this over to Dr. Yaffe to answer on some of the updates that have been attending our federal meetings, discussing that with our counterparts across, knowing there's different provinces have different strategies they try to approach the issue with. We're waiting for our scientific advisory group, NACI, and perhaps Dr. Yaffe will have some more comments to make on that. So there is a lot of evidence and issues moving along at this time, and we're trying to be moving and doing it with the best advice to give the best protection to each vulnerable group in its own way. So, but before I do that, I'm going to hand things over to Dr. Yaffe and give you an update on what some of the discussions have been in regard to the question you've asked.
Thanks very much. This is very much an item of discussion at the federal, provincial, territorial table of chief medical officers. And I'm aware that the National Advisory Committee on Immunization is going to be hearing from experience in British Columbia and Quebec and the UK later this week, and potentially issuing different recommendations or not with respect to the interval between the first and second dose of the messenger RNA vaccines. Currently, originally they went with the product monograph, which was 21 to 27 days. They modified it to up to 42 days. We do know that Quebec uses a longer period, and currently we are going with 35 up to 42 max. But we're very much open to seeing what the evidence is from other jurisdictions, and looking forward to hearing what the National Advisory Committee on Immunization recommends.
Follow-up?
Just back to the regional framework, we do seem to have leveled out at about 1,000 cases a day for the last few days. Is it safe to say that if we stay at this level for a while, there won't be any major movements in the regional framework, that places that are in gray are going to stay gray, places that are red are going to stay red, just to try and, I guess, keep a lid on the strains on the hospital capacity?
So it's a very good question, because when we're looking at the data points, and one of the things we've done from the beginning when we did the reintroduction or the introduction of the framework in the fall, is that we're aware that various parts of the provinces have different levels of incidence, and some who haven't had any cases for weeks would wonder why they'd be under the same constraint as others. And yet we're aware that some of the smaller areas could have an outbreak, and that could push their numbers up high, and they need to come down again in a very consistent manner. So we will continue to address it. As I said, our motive is that if we have concerns that there's some nudging up in areas, even if the overall average is 1,000, if a health unit has a sudden increase in number of cases or an increase in cases, we will not be against moving them up into a higher level. If they have a sudden surge, and there's different things we do with consultation, we always have the emergency brake type situation, especially when we're dealing with the growing issue around variants of concern. And so we'll monitor that. So it won't be stagnant. I would say it'd be fairly stabilized at this moment. We would still like to see those numbers to keep coming down. We still want to see our hospitalization numbers come down. We want our ICU numbers well below 300. We'd like to get below 200 ideally. So as I said way back, while we get down to this 1,000 and under 1,000 various days, we need to be there for a while to allow those hospital numbers to ease off. But I've heard some reassuring comments from some hospital sectors that they're introducing more booked and elective surgery in areas of urgent basis. So that's encouraging that they feel they have that capacity. But there are some that are still quite pressured and put on the issue. So we're in a tenuous time of watching this and observing it. And so we'll continue to be looking at the data every week and updating our minister accordingly with recommendations.
Next question.
Your next question comes from Sabrina Jones from CBC Toronto. Sabrina, please go ahead.
Thanks. Good afternoon, everyone. My question is for Dr. Williams today. It's regarding the letter from the association representing local medical officers of health that says the reopening underestimates the variants and that enacting the emergency break would be too late to have any meaningful effect. When we asked Premier Ford about this, he said this is up to you, doctor. So why is it that all these medical officers of health disagree with your advice? And what's your reaction to it?
Having many conversations with the chair of the Council of Medical Officers of Health, he knows that there's different opinions by some of our medical officers of health. Some feel strongly in some direction. I have some insisting that they would like to open up even faster, and they're upset that they're being held back. So, but overall, I take their word of caution, and we're taking that seriously. And I've reassured the chair that we will be, as I said at the outset, quickly closing down more if we need to, if that's necessary. We'll apply the emergency brake as necessary. I think their concerns were voiced by and backed up with Dr. Brown and said, well, if you do it, you have to do it cautiously. You have to be looking at the data very carefully and being able and willing to move back into certain levels of limitation as soon as you can if you're seeing that. So I still think it's early. We want to see how we're doing with our variants of concern. We see some edging up of percent positivity, so that our tests are more and more of the ones with variants, but the others are going down. And so we have to address that and to assess. So I would say I've taken the letter from the Council of Medical Officers of Health seriously, as I always do. I consult with each one of them in their respective jurisdictions and take their comments and recommendations with those concerns in mind, and we'll deal with that. So again, I don't have issues with them raising the matter on a cautionary basis, but I have said there's others who are still concerned. And I must say, then the council too didn't say, well, close the schools back down again. They want to keep the schools open. So that's also a big priority, which is different than a total lockdown in that way. And so we're endeavoring to keep our schools open as they feel it's very important at this time, and we want to endeavor to do so. So caution is a good word. And we'll keep hearing and listening and taking recommendations and listening to the advice and the data as we make these decisions.
Follow up?
Thanks for that response, Doctor. Yes, another question. Business owners that we've spoken to in the York region are worried people will come from Toronto and Peel, and that this will lead to a big problem for everyone, as these respective regions go into their own different frameworks. Doctors have also complained about this reopening approach. So why are you letting this happen despite this being a very real concern?
So in the issue of health units who bound or border on each other and some slight differences in the framework, what services are available and not available, this is an issue we've had to deal with before as we're doing the so-called ramping up the framework in the fall. In that, the issue in specific you're alluding to with York Region, excuse me, Dr. Kurji was aware of that. He dealt with that in the fall. He put out Section 22 orders and did things that he felt was necessary. When he asked about it, he said that they felt they could control that and deal with that. I think one of the aspects we're always aware of is this balance between keeping down morbidity and mortality. So we want our hospitalizations down. We want our outbreaks down. We want our deaths down. At the same time, we want to try and minimize social disruption, because the more we do some of those things, there are consequences that we have to deal with as well. And we're being made aware of that by various groups who have been sending notes and letters and materials, making us aware of those responsibilities and issues. And some of our medical officer health, like Dr. Kurji, are aware and concerned about that as well. And so the dynamics of being next to each other in health units we deal with all the time, that we may not do things identical with each other, but we can take steps to mitigate any things that may be of issues and concerns, and that certainly is under the authority and power of a local medical officer of health, that they could take steps if there was a concern. And I'm sure that Dr. Kurji would do so if he felt there was an issue that he wanted to deal with.
Next question, and this will be the last question unless someone else joins the queue.
All right, next question comes from Brian Lilly from the Toronto Sun. Brian, please go ahead.
Good afternoon, doctors. I'm wondering if one of you could talk to me about the importance of contact tracing. The City of Toronto and Toronto Public Health effectively suspended contact tracing back in October, only focusing on long-term care settings and such. I was asking Dr. DeVille about it earlier, and she confirmed that they're still not doing widespread contact tracing, that they are being very focused. How important is contact tracing to helping to get a hold of the virus outbreaks?
Yeah. Thanks. It is one of the important things that we need done in an outbreak. In terms of, obviously, there's testing, tracing, and isolation. We are aware that certainly Toronto has so many cases that they don't have the ability to follow up every contact. But there are other measures. I know that they are informing people to tell their household contacts, their close contacts, and to stay home. They have information on their website, and they also identify people in congregate settings, which are higher risk, or schools. We also supply them with help from the province. We have a cadre of several hundred, I believe it's actually over 1,000 people who have been trained to do contact follow-up that help the health units do that. And we also have something called the virtual assistant, which is an email notification of contacts. And of course, there's the COVID app. So there are a number of ways that contacts are informed, can be informed that they have been in contact. But I think it comes back to, we shouldn't depend on that. Everybody has to be aware of the public health measures that we need to do. Stay home. Don't go out if you don't need to. Don't go out if you're not feeling well. If you've been around somebody who's ill, stay home and wait till they get their test result. Wear a mask, and all these basic measures. So not to wait and say, okay, well, nobody's told me I'm a contact, so I don't need to worry. That is just an extra measure on top of everything. But the basic public health measures are the most important.
Follow up, and this is the last question.
Would the province have been able to help Toronto had they come to yourselves or another part of the health apparatus at the province and said, look, we're becoming overwhelmed with the number of cases? My understanding is that they were outside of the provincial system, and it wasn't until the suspension of contact tracing that the province found out. So could you have done something more to help them stay on top of it earlier on?
I know that we've been working with them all along in trying to supplement and support their case and contact management work. They have recently transferred over to the Provincial Case and Contact Management Information System, which is very helpful in many ways, but is only part of it, and we are providing staff support to them, and of course are open to further conversations with them if they wish.
Thanks, everyone.